The doctors, the junior doctors, thousands of them in England have begun a 3-day strike over pay and conditions. Many hospitals cancelled appointments today in advance, though NHS managers said A&E units across the country were still busy. It's the senior staff that are covering the gaps. The newly qualified doctors are asking for a 35% pay rise after a real terms cut of 26% since 2008, once you take inflation into account. Now, according to the British Medical Journal, the pay dispute is having a corrosive effect on retention in the health service. A third of NHS junior doctors say they plan to move abroad in the next year, with the vast majority citing poor pay as a reason. And this is why the starting salaries for junior doctors in places like Australia, Canada, the United States and France can be up to double the £29,000 basic that junior doctors would earn here in the UK. So here is the Health Secretary, Steve Barclay, responding.
Well, I don't think a 35% pay demand is affordable, and for many of your viewers, that will ring very strange in terms of what they themselves have had in their job. So 35% as a demand is not affordable. We've offered to engage in constructive talks with the junior doctors. We stand ready to have those discussions, and I urge them to come and engage with us on that.
So the Australians are getting British subs and they're also getting our junior doctors. Let's talk to Chris Kirby. He is co-founder of the medical recruitment website Messley. He's also penned The Ultimate Guide to Working in Australia as a UK junior doctor. Welcome to the programme. Are the skills so transferable?
They are, and British doctors are in extremely high demand in Australia. They really value the training that our junior doctors have got here. And they're prepared to pay them, as you said, significantly more, and to give them broadly better working conditions as well. Those are the two things that doctors have gone on strike for today. And so we're seeing a vast number of doctors interested in moving to Australia, and a growing number of them actually making the move out there.
Yeah, I read here there was a 17% rise in doctors working in both Australia and New Zealand between 2014 and 2016, and that pattern is starting to re-emerge. Where do they work? Do they work in Sydney or Melbourne or Perth, or are they all sent to the sticks?
They work across the board. There are large numbers of, and these are quite junior doctors, typically moving after doing 2 years of training in the NHS. And they'll get jobs in central Sydney, central Melbourne, Perth, and so on. And some will work in the sticks, as you say. There are lots of vacancies in Australia. And as I said, they love hiring doctors from the UK.
Right. And of course, it's not just the pay, it's the lifestyle. We all know that. The beach, the sun, better weather. What about the stress levels in the Australian health service? Does it compare?
Making generalisations, the hospitals in Australia are generally better staffed and more fully staffed, let's say, than they are in the NHS. And that leads to a wealth of benefits if you're working as a doctor. So happier patients because they might not have had a 10-hour wait in A&E, higher morale amongst colleagues generally, you're more likely to finish on time, you're more likely to get on the job teaching and coaching from a senior. All of these benefits add up to an overall package that makes for a better working life as a doctor. You layer on the fact that your base pay will be higher. You also tend to get paid for overtime in Australia. You get enhanced rates for evenings and nights and weekends, which are quite significant and far more than you would get in the NHS. And you add the beach and the sunshine on top, and it's proving to be quite an irresistible package.
Yeah, you don't hire broadcasters, do you? No, okay.
Potentially.
Chris Kirby, thank you very much for that. I mean, on a serious note, because it is a serious issue for the NHS, Ian, I know you're not an expert on junior doctors, but there is a labour crisis in both our countries. And we operate in the States, you operate state to state. In Europe and wider afield, we work in an international market. And we've just seen a very good example there of why the NHS could encounter a problem with retention.
And we've just seen a soaring cost of living crisis that, frankly, those inflation levels are worse in the UK than any other OSCE economy. And that inflation needs to be addressed. I know there are conversations going on with the ambulance workers, with the nurses, that have led them to call off their latest strikes. I don't see how you don't do that with your junior doctors. I understand that from a fiscal perspective, this is very challenging. And we saw the response the markets had with former Prime Minister Truss and that shambolic, very short administration. But again, I mean, in this environment, I don't see how you don't respond effectively to these sorts of demands.
I wonder, Lord Darrett, whether you have to make a strategic decision as to what is most important. Which sectors do you prioritise?
I mean, yes, you do, and politicians have to do that all the time. That's part of being in government. But I would just say, Christian, that this strike, plus the flood of doctors going to Australia and New Zealand, is a symptom, an important symptom, of a very fundamental problem, which is, as a country, we spend less as a percentage of GDP on health than all but one of the G7 countries. Only Italy spends less than us. America spends almost twice as much. I don't think the American model is one we want to follow, but France and Germany also spend significantly more than us. And that might have worked as a model in the 1950s and 1960s, especially almost all the expenditure on the health system coming from general taxation. I think it now needs fundamental reform, but it's just politically so difficult that governments are solving it problem by problem, addressing each problem as it comes up, but no one is willing to do the fundamental reform, what I think is essential now.
Just very quickly, I've only got a minute left, Lord Darrett, till we go to the break. But you've just heard Ian refer to the Liz Truss government. On a political level, we had an emergency budget when this government came into power with Rishi Sunak heading it. Does this budget need to be squeaky clean next week?
Well, I think so. And I think it will be. I worked for Jeremy Hunt, and he's a very, very straight and very thoughtful and very cautious politician. And I think he will be very, very careful. He will have checked with the experts that the markets will be happy with what he's doing. He will be more cautious than the Conservative Party, or many of them, want him to be, but it'll be a very, very straight and probably rather predictable budget.
OK, we'll go to the break. Chris Kirby, thank you very much indeed for your time on recruitment to junior doctors in Australia. We're going to talk Ukraine. We'll talk about drilling in Alaska, and we'll also